if I say the tetralogy of Fallot, the 4 digits together we call tetralogy of Fallot. One is ventricular septal defect, one is pulmonary stenosis, another one is overriding aorta, and right ventricular hypertrophy. Right ventricular hypertrophy. So the to understand these 4 diseases, right, we have to know what are the normal heart function. So normal heart, if you see the picture here, this one is the right atria, right ventricle, left atria, left ventricle, right? So right atria and right ventricle communicate through the opening or valve, and this is the valve is called right ventricular valve, and this is the interventricular septa. They divided two ventricle. There's no communication at all, and blood is come from upper extremity through the superior vena cava, and from lower extremity inferior vena cava, then go right atria. From the right atria, blood supposed to go to the ventricle, right ventricle. From right ventricle, blood should go to the pulmonary tongue to lungs, where deoxygenated and oxygenated blood is exchanging, and oxygenated blood is come back through this pulmonary vein to the left atria. From left atria, they're supposed to go to the left ventricle. From the left ventricle, they go to the arch of aorta, and they distribute to the whole body. So now we are going to talk about the 4 diseases together. It's called Tetralogy of Fallot. So one of right ventricular hypertrophy. So this is the ventricle. If ventricle is too thick, huge, that times inside the space or room should be reduced the size. So sometimes some baby has a congenital heart problem, and this wall is too thicker like this. When it is too thick, the room inside is too less. That times they do not have enough space to accumulate or collect the blood from left atria. Not enough room. So if it is not enough room, that times they cause a backflow of the blood from this direction, from right ventricle to right aorta, if it is not enough space. So this thickness hypertrophy is one of the congenital problem. It's called right ventricular hypertrophy. As I told you, the two ventricle, right ventricle contain deoxygenated blood, and left ventricle contain oxygenated blood. And blood from this ventricle must go to the lungs. And oxygenated blood come from lungs to left ventricle and distribute all over the body. And this two ventricle is completely separated by interventricular septa. But unfortunately, some of the baby born with a problem, defect in this septa, sometimes abnormal opening in between two ventricles. If the opening is there, the deoxygenated blood directly go to left ventricle. So deoxygenated blood go to oxygenated blood, carbon dioxide mixed with this blood, and this carboxygenated or deoxygenated blood is distributed to the body through the aorta, and patient is get hypoxic, less oxygen to the tissue, exercise intolerance, right? Patient easily fatigue, tired, growth retardation, because tissue do not get enough oxygen. Because of this problem, this is called ventricular septal defect, one of the tetralogy of Fallot. So ventricular septal defect sometimes automatically be corrected. If automatically not corrected, we can correct it surgically. Another problem is here is called pulmonary stenosis. So blood supposed to go from right atria to the lungs through pulmonary tongue. But if the pulmonary tongue is narrowing or stenosis, the pathway is too narrow, blood does not go from right ventricle to the lungs because of pathway is too narrow. So pulmonary stenosis is the one form of tetralogy of Fallot. The last tetralogy of Fallot is called overriding aorta. So you see the blood when come from lungs to left atria, from left atria they should go to left ventricle, from left ventricle they should go to the pulmonary, so they should go from left ventricle to arch of aorta. So this is the artery, major artery, distribute blood to whole body, upper tongue and lower tongue. But in this area, the beginning, this is called arch of aorta. And sometimes the arch of aorta is congenitally defected, defect where aorta is positioned directly over ventricular septal defect instead of the over the left ventricle. Because of this problem, also blood is not equally distributed. So this is the overriding of aorta, another congenital problem. So there are four type of congenital problem. One is right ventricular hypertrophy. One is ventricular septal defect. Third one is pulmonary stenosis, and last one is called overriding aorta. So here